Hello, everyone. Welcome back to the Quick Tip Tuesday series. I'm Dr. Roni MD, and today I'm going to chat with you a little bit about dry skin. It's wintertime, and we're all battling dry skin to some degree. But how do you know when it's more than just run of the mill dry skin? Well, that's what I'm going to talk to you guys about today. So your winter dryness, or conditional dryness as I like to call it as well, is typically caused by something on the outside, your environment, for example. Your skin feels tight and itchy, and this can occur, as we've all probably experienced, when you come out of the shower, the bath, or the pool and don't put on any moisturizer after drying off. Even if your skin is still wet, that water will eventually evaporate off and leave your skin feeling dry. And the chlorine in pool water doesn't help. Another cause of dryness is cold weather with low humidity. The air itself is dry, leaving very little moisture for your skin to absorb. Now, you might think cranking up the heat in your house will help. It doesn't. Central air, wood burning stoves, and space heaters dry out the air as well. There's a few other things that aren't so great for your skin this time of year, or in general. Harsh soaps and liquid soaps strip the natural oils from your skin. Long hot showers and baths tend to dry out your skin as well. And frequent hand washing can dry your skin out too. I'm sure many of you have been experiencing that exceptionally during this pandemic. Okay? So, what can you do about it? So there's a few things you can easily do at home to address your dry skin. 1. After a bath or shower, pat or dab your skin with your towel. Don't wipe it off or rub your skin with the towel. You want your skin to still feel damp. Then slather on a good moisturizer. I recommend Aveeno, Aquaphor, and Cetaphil, which are affordable and effective moisturizers that some patients have used and have had good results with. I personally have had great results using body butters with shea butter, cocoa butter, or mango butters, especially when they're mixed with all natural oils such as olive oil, jojoba oil, and grapeseed oils. 2. If you have been in the pool, make sure you shower shortly afterwards to get that chlorine off, and then moisturize as I previously mentioned. 3. Get a humidifier. They are amazing. Oh my God. They really help to add some moisture to the air during these winter months. And you can even use them in the summertime if you work in an air-conditioned building. Trust me, it gets dry in those buildings if you haven't already experienced that. 4. Use milder soaps with very few fragrances. I personally use Dove soap, just the all white Dove body bar. Um, and Ivory is another one that has been known to be pretty good. You want to limit the amount of fragrances in it. You don't want to get, some of those Bath and Body Works soaps or the ones that you get from certain department stores or from the makeup counters, things like that, because they might have a lot of fragrances in them. Now, if you want to have some scented soaps, you can try some all natural soaps. They may be mild enough and have just a slight hint of fragrance in them that it won't irritate you that much. Now, I mentioned before that I use Dove bar soap. Bar soap is better than liquid soaps because there's a type of alcohol, not the type that you drink, um, and that's in the liquid soaps that dries your skin out. And bar soaps don't have that. 5. Shorter, warm, not hot, showers and baths. Now, I know It's cold when you get up and you want to get that nice, hot, steamy shower. But all that's going to do is strip your skin of its natural oils even more and dry you out even more. 6, keep washing your hands. Please, for God's sake, keep washing your hands. But find some good moisturizing creams and lotions that you can keep handy. What if these don't work? Then it might be something more serious and you'll need to schedule a visit with your doc. Okay, it could be eczema, which is quite common, especially in the African American community, and unfortunately is a little bit more difficult to treat in us. Now, what is eczema? It's a non-contagious inflammatory skin disease that causes an itchy, patchy rash, redness, and scaling. Some people will scratch and scratch and scratch so much that they break the skin, leading to bleeding and scabbing. The patchy rash can be anywhere, especially inside your elbows and behind your knees. Now, if you're darker skinned, you may not notice the redness as much as you just notice darker skin patches. So, who's at risk for eczema? Anyone can develop eczema, but you're at higher risk if you have asthma or allergies, or someone in your family has asthma, allergies, or eczema. It's our little trifecta there. How can eczema be treated or managed? Now, you can continue to use some of the home remedies that I mentioned earlier in addition to medication from your doctor. A medicated steroid ointment may be prescribed. And remember, ointment is better if you have eczema than creams. Creams are more water-based. Ointment is more oily in its consistency, and that's better for your skin. Now, these steroid ointments are stronger than the over-the-counter ointments and come in different strengths based on how severe your eczema is. With the steroid ointment, you only want to use it directly on the itchy patches, not all over your body. And you only want to use it as needed, not necessarily every day if you don't have those itchy patches present. Prolonged steroid use can lead to some skin changes, some minor skin infections, eye changes, hormonal changes, kidney issues, and electrolytes, which are like your sodium, your potassium, your calcium, things like that. It can throw off the balance of those. Now, don't let this scare you into not using the steroid ointments. If they're used properly, they can give you some great relief, okay? Trust me. Use the moisturizers, Aveeno, Cetaphil, Aquaphor, and even Vaseline, because it's got that, that oily or the thick or emollient texture to put all over your body, where the steroid is just in the patches, okay? So I hope that this helped. One, if you just have dry skin and you're trying to figure out what to do about it this winter. Two, if you might have something a little bit more severe that you need to go talk to your doctor about. And hopefully you learned a little bit more about how we treat them, why we treat them the way that we do, and how you can do things at home to help your skin, whether it's just dry skin or something a little bit more serious like eczema. So, till next time, I'm Dr. Roni MD, and I'm being paid to take care of you.